Ready for a quiz question on the topic of the cardiac exam? Who am I? I occur in early diastole as blood is passively filling from the left atrium to the left ventricle. I am low pitched and heard at the apex with the bell of the stethoscope in the left lateral position. I am known as a ventricular gallop. I may be physiologic, but mostly pathologic after 40 years old. When I am pathologic, it is due to a high ventricular filling pressures and volume overload. I am the S3 heart sound. Causes include reduced myocardial contractility, heart failure, and ventricular volume overload from aortic or mitral regurgitation. Thanks for taking the quiz.